Hey, all you cool cats and kittens. It's Travis from Big Cat. Oh, wrong group. This is a nursing Pecha Kucha about the difference between 12 and 8-hour shifts. This presentation is brought to you by Travis Fuentes, Catherine Honecker, Brianna DeWoody, and Melissa Mixon. Hospital nurses typically work 12-hour shifts, which tends to be the more popular vote amongst U.S. nurses, whereas clinic nurses in the United Kingdom typically work 8-hour shifts. This long standing debate over which is the more dominant shift continues to rattle the healthcare industry to this day. One of the downfalls of 12-hour shifts is that often nurses who work in specialty areas are on call, even while at home with their families. Especially now with the COVID-19 epidemic, more nurses are being asked to come in, work longer shifts, and find themselves fatigued and exhausted at the end of the shift. Due to nursing shortages, nurses have been working longer shifts and more consecutive days during the COVID-19 pandemic. The governor of Texas, Greg Abbott, has waived several regulations to help meet the state's need for nurses during this critical time in our country's fight against the COVID-19 virus. Studies have shown that nurses prefer the 12-hour shift for a variety of reasons, relating to their personal life, building relationships with patients, and less workdays. Although there is a long standing debate on whether or not a 12-hour shift negatively affects the care patients receive. Further pros of a 12-hour shift include more flexibility with life outside of work, easier childcare situations, and increased learning for nursing students during one shift. These shifts allow nurses the ability to work at their own pace during the day rather than feeling rushed to get tasks completed. 12-hour shifts provide nurses those critical extra hours to get things done, and thus nurses feel more fulfilled at the end of each workday. Also, nurses are allotted more time to get to know patients and build lasting, trustworthy relationships that make the patients feel more at home. Although, there are many cons to the 12-hour shifts as well. These extra hours often turn into 13, sometimes 14-hour shifts with excessive documentation or patient handoff, sometimes even decreasing quality and safety of patient care due to increased fatigue of the nursing staff. Studies have found that nurses' performance decreases during the last hours of a shift, and they are more likely to make medical errors when compared to 8-hour shifts. Nurses are more likely to take unofficial breaks during a 12-hour shift when in comparison to an 8-hour shift. 8-hour shifts have their fair share of benefits as well. Research shows that medical staff reports less medical errors are made during an 8-hour shift when in comparison to 12-hour shifts. An example would be a decrease in staff needle sticks and a decrease in medication administration errors. 8-hour shift pros continued. Nurses are less likely to skip their lunch breaks due to an increased staff during lunching hours. Nurses are also less likely to take unofficial breaks during 8-hour shifts since their days are shorter to begin with. There are also some cons to 8-hour shifts as well. Nurses feel more rushed when switched to 8-hour shifts. Nurses find it more difficult to organize their days when compared to having 12-hour shifts, and also nurses have less time to get to know their patients on a personal level. Some further cons of an 8-hour shift include nurses feeling unfulfilled or dissatisfied with their work after an 8-hour shift versus how they feel after a 12-hour shift. There's also more patient handoffs. This equals a greater opportunity for small details or patient information to slip through the cracks. Even students feel the benefits or disadvantages of shift differences. 8-hour shifts are nice because you have 4 to 5 hours to study or be with family, while in 12-hour shifts, it's likely you only have time to eat, shower, and get to bed so you are well rested for your next shift. However, there are solutions to the problems that have been reported by 12-hour shifts. For example, if nurse managers want solely 12-hour shifts, they should schedule adequate recovery time for nurses between multiple workdays to allow nurses to be well rested and relieved of any fatigue. Although managers must advocate for their workers, nurses themselves must be their own advocates in the workplace. For example, nurses need to realize when they are fatigued to a point where there is a lack of clinical judgment. And nurses should delegate tasks when appropriate to reduce fatigue in the workplace. Nurses can delegate many tasks. For example, they can delegate standard care planning, vital signs, passing medications, and removing sutures to LVNs, while also delegating transporting within a facility, personal hygiene, cutting food, and socializations and ADLs to UAPs. Despite so many studies, there will always be debates on whether 12 or 8-hour shifts are better, because, like every topic, everyone has their own opinions. We must keep in mind, though, that each shift length has the same goal in mind: providing the best care possible to our patients and providing safe care to everyone in the hospital. In just a few weeks, we will all be entering the nursing workforce, so it's important to think about which shift length fits your lifestyle and wishes better. In the US, most hospital nurses work as 12-hour shifts. If you're someone who prefers 8-hour shifts, working as a school nurse or clinic nurse may be the better option for you. When applying for jobs, it's important to keep this aspect in mind. If you had to choose, which would you choose? We each chose 12-hour shifts because we believe it provides us the best opportunity to either further our education or start and maintain a family once we graduate. Thank you for coming to our TED Talk. Big Cat Lady, out.